Hello and welcome to Lynchburg Live. I'm your host, Linda Smith. October is Cancer Awareness Month, and we're going to start tonight's show with a brief film about breast cancer and early detection, which I hope will be helpful.
Breast cancer is the most common cancer in women, and it can be successfully treated if it is diagnosed at the earliest possible time. The earlier a breast cancer is found, the more options for treatment are available. Breasts are composed of fatty tissue and fibrous supportive tissue, milk glands, and milk ducts. This is why breasts feel lumpy. A breast cancer may take many years to become large enough to be felt by hand. By then, it could be the size of a... But in many cases, mammography is sensitive enough to detect a tumor several years earlier, while it is still as tiny as a grain of rice. The American Cancer Society recommends that women have mammograms a year, beginning at the age of 40. If you have a mother or sister who had breast cancer before menopause, your doctor may recommend that you begin having regular mammograms earlier. Talk with your doctor or nurse practitioner about the benefits of mammography and about a plan for your regular screening examinations.
When you're diagnosed with breast cancer, you immediately begin working with a team of individuals who stay with you and help you through the experience. One member of your team is an oncology breast cancer navigator. My guest tonight is Kara Lamb. Kara is a registered nurse and an oncology breast cancer navigator. Kara, welcome to Lynchburg Live. I'm delighted to have you as my guest.
Thank you. It's an honor to be here.
To start off, for people who don't know what an oncology navigator is, will you tell them what that is?
Yes. An oncology navigator is a registered nurse who helps to navigate patients who have been newly diagnosed with cancer through their cancer journey.
And this is a relatively new concept, the
Yes,
navigator concept?
Yes, it is. The term oncology navigator is actually fairly new within the past couple years.
You know, I can really applaud Centra Health for being innovative and bringing these programs into our area. You know, I think it's any service that they offer that's going to help a patient through and make it easier for them. It's a wonderful thing. What specifically does a breast cancer oncology navigator do?
Okay. As a breast navigator, we typically get in touch with women shortly after the time of diagnosis and follow them through initial consult visits with physicians, follow them through surgery, meet with them after surgery if they've had a mastectomy. We also meet with them at the time of their consults with a medical oncologist or radiation oncologist, continue them through the treatment phase of their journey, and continue to follow them after they complete their treatments.
One of the things that I found so helpful was after I got my diagnosis, somebody from you contacted me immediately and met me at the hospital when I had surgery and has been there for me, you know, throughout the duration of this experience, which it gives you someone to turn to and somebody that you develop a relationship. And I think that's so important that you have that person there that you can pick up the phone if you want to and call and ask questions. I saw on Tab O'Neill's Living in the Heart of Virginia, he did an interview with a prostate navigator, oncology navigator. Is that somebody who's local, or was that?
Yes, yes, she's also housed at the Pearson Cancer Center.
Do we have other navigators, like for colon cancer, lung cancer, for specifics of cancer?
We currently have 2 breast navigators. We have 1 prostate navigator and 1 lung navigator. We also have a nurse who is a palliative care navigator who works with patients and families at the end of life.
I think that's wonderful. So we do have other navigators
Mhm.
for specific types
Mhm.
of cancer in this area, and that's through the Pearson Cancer Center and
Correct.
Centra Health.
Correct. And the navigation services at the Pearson Cancer Center has been one of our fast-growing services that we provide, and it's continuing to grow. Probably in the next year or so, we'll continue to add additional navigators for different cancers.
I think that's wonderful.
Mhm.
You're a registered nurse.
Mhm.
Do you have to have any other specific kinds to do oncology navigation?
An oncology certification is a requirement if you've been there at least a year as an oncology navigator. Additional courses in, breast cancer specifically, lung cancer, whatever your specialty is definitely strongly recommended.
Oh, I had no idea.
Mhm,
That's
mhm.
really interesting. As an oncology breast cancer navigator, what specific activities do you find involved in during Breast Cancer Awareness Month that you might not do on a day-to-day basis?
Okay. October certainly is our busiest month. Throughout the year, we do community education programs and health fairs. Us, but a team of ladies who are survivors that we work with that make up the Witness Project. The Witness Project is a group of women comprised of breast cancer survivors and also lay health advisors, which are just kind of your average lay health person who has an interest in educating the community about the importance of breast cancer awareness. And those ladies are very instrumental in getting the word out there, and we could not do it without them. So we do have more programs, more health fairs during October.
Do you work in conjunction with the American Cancer Society as well, or is...
There are some activities that we do with them. We, use a lot of their services. It's kind of a collaborative effort between us.
As a breast cancer, I keep running into women who say, I haven't had a mammogram since 2002, and they kind of laugh about it, and I'm thinking, that is so wrong. You need to be doing this. Know that some of them are afraid of what they're going to find, and they don't want to hear a diagnosis, and that's so illogical, but you can almost understand it because there's a lot of fear associated with breast cancer.
Absolutely. I think one of the things, because I've been in the field of oncology now for 11 years and working with people of all different types of cancer diagnoses, and one of the things that is encouraging to me about breast cancer is it's not a death sentence, especially if it's detected early. And that's what I tell women is, as soon as something abnormal or your gut's telling you that something just isn't right, get it checked out right away, because your chance of long-term survival is much, much better.
And you don't have to be 40 to wait.
No.
I mean, people with family history are encouraged to go, and say, look, I've got so many people in my family who have had this disease, who've died with this disease. I don't want to be one of those people. So they're encouraged to go. And, I am using this show on occasion to bring the word to women. Go get those mammograms. Don't put it off. This can save your life.
Absolutely.
I feel fortunate to have had this detected with me in my annual mammogram. It was very, very small. And, if I can help anybody else go at that same kind of diagnosis, then that's certainly what I want to do. The navigator that worked with me was someone who had had a breast cancer diagnosis and was also a nurse. And I've been wondering if you try to assign people to patients that are compatible or have some sort of history, similar background.
It doesn't usually work that way. Sometimes it just coincidentally way. My fellow oncology breast navigator is a breast cancer survivor, and I think that adds a dynamic piece to our program because she is able to relate to women on a whole other level than I can.